honestly, the power of healing, nurturing relationships, whether you are a child or an adult. One of the ways in which I incorporate this into my own well-being practice, one of my favorite things is the walk and talk, right? Which I do either in person with a girlfriend or even if we have to do it on the phone. And if you can have that healthy relationship part where you're talking about what is the real stuff that's going on with you and you're getting your steps in, that's like, something I really recommend.
Aloha, everyone. Thank you so much. I hope you could hear me. Well, we're going to dive right into it. So, Dr. Burke Harris, you have devoted so much of your career for screening for childhood trauma. Let's start with just the basics. Why is trauma so important to focus on?
Because when we look at the science, so first of all, I'm a hardcore science nerd, right? And when we think about some of the biggest challenges that are facing our communities today, whether it is families who are unhoused, whether it is chronic disease, the cost of healthcare, mental and behavioral healthcare, all of these, some of the most challenging and intractable challenges that we see, right? What we see is that there's really, really strong data that shows that adverse childhood experiences dramatically increases the risk for mental and behavioral health disorders, homelessness, heart disease, stroke, cancer, Alzheimer's disease, right? And so for myself as a clinician, I was trying to understand, how is this possible? You have these 10 ACEs, and then there's a little mystery, and then you see this dramatically increased risk for 40 health disorders, increased risk of incarceration, increased risk of, all different things. And so one of the things that we now understand that science has been able to answer really well is that exposure to trauma or adversity in childhood affects the body's biological stress response, our fight or flight response. And when we see changes in the way that stress response is wired, right, and those changes can be lasting throughout life, that dysregulated stress response, which is what we now know of as the toxic stress response, is the mechanism or the driver for increased risk of mental health disorders, behavioral health disorders, heart disease, stroke, cancer, and so increased risk of incarceration, right? Like all of these different things. And so one of the key pieces that I recognized as a physician and clinician was early detection and early intervention to help address the toxic stress response can improve outcomes for all of the downstream outcomes.
And so that our audience has sort of a framework, I know some of you have probably read her book, and if you haven't, I highly recommend it. And especially those of you who are parents or know parents, this is a book I feel like every parent should read. I really wish that it was given to me at my baby shower. I think it is required reading, honestly. But when we talk about ACEs, what kind of experiences really familiar are we talking about?
So the original ACE study was done in a population of 17,500 adults, so a lot of people. And they asked about 10 categories: physical, emotional, or sexual abuse, physical or emotional neglect, or growing up in a household where a parent experienced mental health disorder, substance dependence, incarceration, parental separation or divorce, or intimate partner violence. And one of the things that we understand is that there are, the high doses of adversity without adequate buffering, nurturing care, right? Like all these things activate our stress response. And then biologically, the way a child regulates their stress response is through a caregiver who is tuned into them, right? So if your caregiver isn't able to tune in because of a mental health disorder, or because there's violence in the home, and or because of the substance dependence, or because the parent is being violent, right? That's when we see the changes in biology, right, that leads to long-term dysregulation of the stress response.
Thank you so much. Governor, you, of course, as we noted at the top, started out in Kabu dealing with families, some of whom did experience trauma themselves. And now you've really made trauma a big part of your government. You're the first in the country to have this Office of Wellness and Resilience. Not about the experience as a clinician has informed then your policy decisions in your role as governor.
Thank you, Yunji. So that was the reason that we were able to take this approach. All credit to Tia and her team in the Office of Wellness and Resiliency because they pressed us to do this. Where's Tia? She's fantastic. Yes. There we go. Okay. So in Ka'u, the joke as it ran normally was I became the doctor for 4,000 Filipino patients, 4,000 Hawaiian patients, and 15 witness relocation patients from New Jersey. And yes, so this one's one of them. And truth be told, there was so much trauma in the community that you'd see absolutely day in and day out. Much of it was because of poverty and just as we described the health disparities, much of which were based and rooted in economics and racism, we saw that over and over again. So I saw the parents where they were struggling so much, and you could see the children that now, were wrestling with these traumas day in and day out, lack of resources, and all of the indicators were off the chart. People were being incarcerated at a rate 100% higher. People were experiencing chronic disease at a rate 100% higher. People were experiencing homelessness at a rate 100% higher, double each time. And it was just no coincidence. It was simply evident that that is what was happening. And so it should end up coming as no surprise that when we talked to good public health leaders, they said, yes, our Hawaiian community, Jamie being one of them, were dying an average of at least 10 years earlier, having chronic disease, 8 to 10 years earlier. Jamie's mom, a brilliant woman, died of a gastric cancer when Jamie was just 9 because she didn't get screening. She didn't have access to care. And these are traumas that just cascaded over one another. And so when I was fortunate enough to run for office and, that story, the guy ended up being a cocaine dealer and I won my first election, a very unusual process. I got, so he had traumas of his own, for sure. I got the opportunity to get a PhD in the life of our people. And so we tried all these years to actually look at what would help people, even though it's hard, because it seems like the forces out there often are pushing out against us to do kind of the thought leadership work that Nadine does. But we are able in our beautiful state to be inclusive and to take up these challenges, which many of you do. And that, it really comes literally out of that little clinic in Ka'u.
You mentioned, Dr. Burke Harris, this biological stress response it has. And it seems pretty obvious that, I myself, a child of divorce, that brings trauma, that brings psychological trauma. Maybe it's something that you talk about with a therapist. It does not seem as obvious that would then lead to the kind of health outcomes that you outline in your book. Then you could have higher instances of heart disease and cancer and chronic illnesses. What is it about the trauma that leads to a physical response that you see these outcomes then?
Yeah, so the way that our stress response works is that when we experience something stressful or traumatic, it activates the release of stress hormones in our body. And these stress hormones, like anybody think about when something really scary has happened, right? What happens? Heart pounding. What makes your heart pound? Increase levels of adrenaline in our bloodstream. Adrenaline is a stress hormone. It's released by these little glands on top of our kidneys, right? And so if you think about, so let's think of heart disease for as an example. If you think about, well, let me actually get, I'll back up and say something. I shared this at the medical meeting yesterday, right? So if you imagine, I always say, imagine you're walking in the forest and you see a bear, right? Our brain's fear response, the amygdala, sounds the alarm, right? And it tells our brain and body to release stress hormones. So, our heart starts to pound, our pupils dilate, our airways open up, we send lots of blood to our big muscles for running and jumping. And so that means we're ready to fight the bear or run from the bear. But if you were to think about it, fighting a bear would not seem like a good idea, right? Because he's big and he's got teeth and he's got claws. And so the fear center of our brain, this amygdala, sends projections to the front part of your brain, your prefrontal cortex, which is responsible for executive functioning, impulse control, and judgment. And it turns it way down. Because the last thing you want, if you're in a forest and there's a bear, is some impulse control getting in the way of survival, right? And instead, it turns up a part of the brain called the noradrenergic nucleus of the locus coeruleus, or as I like to call it, the part of the brain responsible for, I don't know karate, but I do know car-racing, right? And it gets us amped up. Now, the less obvious thing that happens when we activate the stress response is that it also activates the immune response, because if that bear gets his claws into you, you want your immune system to be primed to bring inflammation, to stabilize that wound, so you can live long enough to either beat the bear or get away. So this is brilliant. It was evolved over millennia to save our lives from a mortal threat. But the problem is what happens when that bear comes home every night. And this biological response is activated over and over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging.
Talking about the election now, is that right?
So this is one of the things that happens when you have high doses of adversity in childhood, right, is that children's brains and bodies are just developing. So high doses of adversity in childhood affects the way children's brains and bodies develop. And so what we see is, if you've ever, what I was seeing in my patients was, the greatest example, if you want to know how a child's stress response is working, is walk in and it's time to give immunizations, right? Right? And we would just see this rainbow of reactions of kids with overwhelming fear. And we would also test the other ingredient that determines whether something becomes a toxic stress response, which is how the caregiver responded to them, right? So there's some caregivers who are like, hold them down, I gotta go back to work in 5 minutes, right? And then there were some caregivers who would hold their child, sing to their child, connect, right? And you really saw the ability to soothe. And so you can imagine that if that biological process is happening even 2% more, right, in the body, what happens is when you have this really strong, for example, pounding of the heart or increased blood pressure, over 40 years, 30 or 40 years, you have increased wear and tear on the linings of the inside of our blood vessels. And so you have more likely to have tears in the lining of the blood vessels. Well, what happens now? You have more inflammation. More inflammation comes to heal that tear. And what do you have? Atherosclerotic plaques, right? And that's part of the reason why the childhood adversity that happened when you were this big leads to the ischemic heart disease when you're 40 years old.
And when you would recognize that in a patient, when you were first starting this out, and I know you gave the example of Diego in your book.
Yes.
When you see those symptoms, what kind of clinical interventions are possible in the moment and then later on as adults?
Okay, so one of the most important things, a couple of the most important things, right, is that some of the clinical interventions that we do in the moment. So even, for example, as a primary care clinician, and anybody who knows, if you've gone to the doctor, you've gone to your primary care doctor, you don't have that much time, right? And so some of the things for primary care clinicians is even, there's something that I have learned from mental health professionals, which is called co-regulation, right? Which is how you are able to regulate your own response. If you're a calm and steady and soothing presence, it helps the other person calm down. And in doing that, for example, in my pediatric practice, not only would we help the child calm down and be able to regulate themselves, but we also modeled for their caregiver, oh, that's what I do. Like, instead of screaming at my kid, I just saw that doctor just had a moment of tuning in with them and checking in with them. But recommending interventions like mindfulness intervention. So in the course of a clinic visit, whether you're seeing adults or kids, adolescents, right? You can just take a second and let's download a mindfulness app on your phone, right? We're going to download a free mindfulness app on your phone. And mindfulness interventions are associated with reducing the fight or flight activation and increasing what we call parasympathetic activation, which counteracts the fight or flight response. And so my prescription to you is going to be, we're going to start with 5 minutes a day. You're going to do mindfulness, come back to see me in a month, right? And we're going to practice that. What's powerful is that we also recognize that there are some indigenous practices that the wisdom of our elders have taught us that also contribute to regulating our biological stress response. And learning from the wisdom of those indigenous practices is another way that we can do culturally appropriate and culturally responsive interventions with our communities.
Thank you for that. And I think the cultural piece is very important, and Dr. Kamolakula referenced some of that. Governor Verena, I would love for you to weigh in on that with your experience in Ka'u and then now your experience in leadership. What aspects of trauma do you see unique in Hawaii, and how do we address them through the Office of Wellness that you've established, and in other ways as well?
Well, it was so fascinating to hear what Nadine had to say about the process of trauma and providing some calm. And that, I will share, is how we decided to approach COVID from our team. So if you recall, we had the whiteboard, right, which became quite crazy and funny because we could write little things on there all the time. But the sense of the unknown and the trauma that was occurring because of extreme fear and all of the physiologic response that the good doctor just described was happening to everybody that I knew. And the ability, especially in primary care, we spend a lot of time on this to bring some calm to people, to help them to better understand what they are dealing with, to share through a good history and an exam, but really time together to bring calm was what I felt would be meaningful. And that's why I believe we ended up doing better than a lot of other places. The same can be said after the wildfire. Extraordinarily traumatic event for, first, of course, the people we love in Maui, but then the whole state, to witness a part of our state devastated. We all in Hawaii, as we know, have like 1/2 to 1 degree of separation from people. We all knew someone. And therefore, it was another collective trauma for our state. And again, we had to not just deal with the crisis and disaster that ensued for the first month, say, but also how it would affect us as a society. And these are very important things, I think, that we have to try to do, and we have to try to do well. In our case at the government level, and most of healing is done just in the relationship space between people. I think government can, if it's working pretty well, can embrace that so that we encourage more connection between patients, families, and their provider. Encourage extra support to do all these things which are really time intensive and complicated, actually, to get people who have had years and years and years of this toxic stress to come into a space where they can begin to heal. And so that's where Tia's team and wellness comes in, and at least acknowledging that we will be a trauma-informed state, because it opens up a lot of those other doors. It opens up the doors of sociology in medicine. It opens up the doors of psychology in medicine better than other places. It opens up the shared space of social workers and community health workers and so on, again, in the space of people's lives, because they're only going to get to see their physician or healthcare provider, for 15 minutes every 2 months, maybe, right? So that's where I think we come from, and we're just trying to lay a foundation and then let people run with it, run with these concepts so that in this next generation, we have dealt with some of the really deep traumas that exist in society.
Dr. Burke Harris, I'm interested in if you can kind of answer in a sort of in a similar way, but looking at California and your work there, Surgeon General, you talked about the mindfulness app or, having parents or caregivers provide that kind of buffer to that toxic stress that you were talking about. The governor's talking about how you sort of apply this on a wide scale. I'm interested, given the experiences that you had addressing trauma one-to-one as a physician, how you then apply that in your work as Surgeon General.
So one of the things that's super clear is that early detection and early intervention improves outcomes, right? And so in my role as a clinician, I worked incredibly hard to find the best, most evidence-based intervention for helping to regulate the toxic stress response, right? And in order to be able to do it, I had to tap dance morning, noon, and night to get grant funding from here and from there, and we were screening for ACEs. We were responding with these evidence-based interventions, but the amount of work that we had to do in order to be able to just deliver these services was unsustainable, right? So in my role as California Surgeon General, one of the first things we did, the legislature had passed Assembly Bill 340, which allowed for reimbursement to primary care providers for trauma screening. And so I led the implementation of that effort to reimburse our primary care providers to screen for ACEs. Because it turns out that if you have 2/3 of the population that have experienced ACEs, as we do in the United States, you have to screen the whole population. So if you're waiting for folks to get to mental health care, it's too late, right? The second piece of it is that if we know early detection and early intervention improves outcomes, right? But literally the way our system was set up was that a child had to be harmed, they had to be symptomatic, right? So we know there's this dysregulated stress response. So we're gonna wait until it has so affected their brain development that now they're expressing, they've got substance dependence or depression or suicidality, and that's the only time we recognize it, right? If they have asthma or autoimmune disease, we don't recognize it at all, right? Even though a child with 4 more ACEs has double the risk for asthma. But anyway, so then we recognize it, and then they qualify for treatment. One of the most important things that we did in California was not only reimburse healthcare providers for screening for ACEs and requiring them to be trained in order to qualify the reimbursement, but we also said children are eligible to get access to care based on risk rather than based on harm. So we said kids with 4 more ACEs, you don't need to be diagnosed with depression. You don't need to experience suicidal ideation. You don't need to be substance dependent. You can get care because we already know, we have data from 22 countries, hundreds of thousands of individuals, that your risk of developing an adverse outcome over time is quite high. Your risk of having the toxic stress response. So we're gonna say these kids qualify for care. And the last thing I will say about that is that, of course, right, when we said this, oh, you're gonna overwhelm our mental health system, we don't have enough providers. There aren't enough providers in the world to meet the need as it is right now, right? And so one of the pieces that was so important was recognizing that when we open up eligibility based on risk, if you have a child with 4 more ACEs but doesn't have a mental health disorder, they can be seen by a community health worker, right? Who can be trained to deliver the evidence-based interventions that help to regulate the stress response. And that's what we've been doing.
Governor, it just makes sense from when you look at it from a financial standpoint, and then let alone obviously the outcomes, but where she's talking about this harm versus risk and getting it on the front end. How do we then apply something broad scale like that here in Hawaii?
Well, it helps to invite the expert to share with us exactly what has to be done. There is no way to agree enough with Nadine. Why don't you share with them how much what the financial impact would be on Hawaii if we allow these things to run rampant.
So in December 2023, the CDC published an analysis of the cost of ACEs across the United States. So here in Hawaii, that number is $40 billion per year in direct healthcare costs and lost productivity. And recognize the bulk of the dollars, in order to do this analysis, they got IRS data, they got Department of Education data, they got Department of Justice data, and they said, how much is it costing our society when an individual ends up with a mental health disorder or ends up incarcerated or ends up with cardiovascular disease or which is honestly more typical. The typical situation is they have diabetes, heart disease, and depression. All three and they developed those 10 years earlier. All three of those things are much harder and more expensive to treat, right? And so that is where these numbers, so when we're talking about $40 billion per year just to the state of Hawaii alone, the investments that we make now in trauma-informed care, right? We can't afford not to do it.
See, I just want someone else to say it because I've been trying to say this for a very long time. And it's and for perspective, everyone remember our total budget per year, all the money that we put in from the state side and all the money that we hope to put in from the federal side, notwithstanding the current Armageddon, is $20 billion a year. 20 billion, but the impact could be as much as 40 billion. We do about $90 billion, all things Hawaii, but this could account for 44%, if my math is correct, if we don't do the right thing. So it's incumbent on us to lay it down, that this is the way to go, to build a health system, to allow our institutions to say, we're going to do it differently. We're not going to wait for a tragedy to occur where we see the tragedies together, but we're not even going to wait for the quiet tragedies to build up. And that's why it will take a little time, and people may not see the full result right away, but training more community health workers, asking people to sustain a life as a social worker, to have nurses fully credentialed and have the capacity to be fully part of the health system with the docs is the way we have to go. Because we will, if we're smart and follow this model, we'll be ahead of everyone else except for California, who has really been thoughtful about this. But we're small enough to know the providers, and we are close enough. I think you guys all pretty much are familiar with one another with maybe one link if we took the time to do it. That's how we do this.
Dr. Burke Harris, I want to key on that to a statistic that you just shared, that 2/3 of Americans fall into having one or more ACEs. Tell us about recognizing where this problem lives and to be the risk or the downside, if you will, of thinking that this is just a problem in communities that are more vulnerable, communities that experience and poverty. If you look at that ACEs list, just the appendix of her book, there is a list of the ACEs. If you take the quiz yourself, my guess is that these 2/3 in this room will find themselves in that show.
Yeah, so one of the interesting things is that the original ACE study was done in a community that was 70% Caucasian, 70% college educated, right? And so, so when we look at, so for example, California was the first state to reimburse providers for ACE screening. The second state was Wyoming, right? Wow. So again, this is not like a blue state, red state issue. This is something that is an all of us issue. But one of the things about it, I would say that if I had designed the ACE study, I would have included the impacts of, for example, discrimination, or things like that, but I didn't. And so it just doesn't happen to have that in there. And I think one of the things that's really interesting about it is that the fact that it just doesn't happen to have that in there is something that we can use as a tool, because I'm just gonna say this. You said this is a safe space. I can let my hair down. So a couple years ago, and this was before all the craziness, J.D. Vance wrote in his memoir, Hillbilly Elegy, that when he learned about ACEs, he did his own ACE score, right? And that he wrote in his book, I think his score is a 6, right? And that he then was looking among his family members. Now, J.D. Vance has reversed a lot of the things that he said in his book, but I hope the recognition that ACEs happen in all communities, right? In every latitude and longitude. One thing I think is really powerful about the science that's really important to me is that we understand that ACEs are risk factors for the development of the toxic stress response, right? And as we heard earlier, right, we also know that the forces of colonialism, right, also generate a lot of toxic stress, right? And the point is, for me, is that when we get better at treating toxic stress, right, everybody wins. Whether you're in Wyoming, whether you're in Hawaii, whether you're in California, the better we get at treating toxic stress, then we see decreased healthcare costs and improved health outcomes for all of our communities.
Yeah, I'm here, and I think about the way that you framed the affordable housing conversation and talking about housing as healthcare, criminal justice as healthcare. You really, and I would assume that you come to that being a physician, but talk a little bit about, what Dr. Burke Harris just mentioned, this idea that there are other ACEs that may not be on the list, but that are affecting all of us. And what are some of the challenges here in Hawaii specifically?
So, yes, Doc, one thing that Yunji's reflecting on is that we have a large percentage of our population that's homeless in Hawaii, because there's been socioeconomic drift, and sometimes people come to Hawaii, but also generational poverty has affected us. And we decided that as we cared for the people that we see suffering on the streets, that they all had incredible stress responses. Every single person, by the time they'd been on the street for 3 or 4 months, had severe trauma, psychological trauma, sex assault, physical trauma, everything. So they were accumulating in my book. They were accumulating these stressors. You could say ACEs. You could say that they were victims of great discrimination. But call it what you will. The traumas had accumulated so much that their health outcomes were disastrous. And so when we did the analytics on it, for example, we found that an individual who was chronically homeless was living exactly 3 decades less than the other individual in Hawaii that wasn't without a roof over their head. So 81 years was the average lifespan, otherwise 51 if you were on the street. And so from my perspective, what you describe is very an elegant description of what can happen, and we were seeing it in that space. So therefore, housing for us becomes healthcare. And as I mentioned earlier, the likelihood of becoming houseless and being on the street was twice higher if you were Hawaiian or African American. So, individuals through, I'd say, discrimination had accumulated some trauma already, and so the deck was becoming very stacked against people. And I don't know when America will wake up, but I don't think it's sustainable to have now 650,000 people without a home. And we noticed at our Queens Hospital, 30% of the individuals that were experiencing trauma in the ER were homeless. And so we had no adequate resources for the broader population, and so on and so on. So these were lessons that we learned in some ways the hard way through just direct observation, not even aware of the ACEs study, but there it was underlying it right before our very eyes.
Dr. Burke Harris, can you talk a little bit about the uptake of ACEs screening, why the screening is so important? Like, it's obvious from our conversation thus far, but when you're making that pitch to providers about why they need to include this at their practice and what they then do with that information, how is that received? How many physicians are actually doing this, and how does get more to be able to do this?
Yeah, so since we launched the ACEs Aware initiative in California in January of 2020, and after that, there were no doctors who were busy doing anything. Just everyone had lots of spare time. We've trained over 40,000 clinicians to date. So more than 3 million screens have happened in California. And the highest level of uptake has been among our pediatricians. So it's like highest among our pediatricians. Our OB and like maternal care docs are kind of the second highest. And then our adult medicine docs, still there's not as much of a culture and an uptake, but it's really important. So more than a quarter of California kids on Medicaid have been screened for ACEs, which is a little bit wild to think that we were able to achieve that during the pandemic, right? So in terms of the uptake, number one, it's really important if we say that this is important and we say that that trauma-informed care is important, that we're reimbursing providers for doing this training, right? For doing this work. And it's a clinical intervention like any other clinical intervention, and it's really important that folks be trained and that they be reimbursed for their time. I think the other piece of it that was really important is helping clinicians recognize that by doing the screening, they can open eligibility to get care for their patient that their patient might not otherwise be eligible to receive. And that piece is, so there are a couple key reasons why clinicians may feel hesitant about screening. Number one, they don't have the education or the training, so they don't know how. No one's going to do something they don't know how to do. Number two, if they don't get reimbursed. Number three, if they don't feel like they have an effective something to do after they've identified an issue. And this is why investment in clinical and community partnerships for responses when we identify ACEs or other risk factors for toxic stress is really key. And so investing in all of those pieces are what we needed to do in California to allow this transformation in the ecosystem.
Yeah, can we do it here?
Yes, so some of the things that don't appear as sexy in what we've been attempting are being put into place. For example, we have just so everyone knows, 1 out of 3 of our individuals in the state are on Medicaid. I'll remind people, we were at 1 in 6 before we went through, the economic downturn and COVID, right? So there's that. And so being supportive to the end, if we can be, of anyone who is struggling as an Alice family economically, we give them care, so they have access. We haven't done some of the important things to fully, approve and fund, authorize ACEs screening and then getting people into care, but we're also looking at it from the other side, which is, as everyone knows by now, we have this HELP program, which is loan forgiveness for any healthcare provider. And we are amping it. Our goal is to get to everybody, from social work teams to psychiatrists to psychologists, family docs, pediatricians, anyone in the system, and repay all of their debt, provided that they care for our society, that they take Medicaid, right? Thank you. And so the approach there is, we're building this system and putting more and more people into the exact service spaces of the healthcare team, and we're making it a little easier to stay in Hawaii without that debt, because it's expensive here. And so having that team ready when we hit the switch finally, which we have hit a couple of switches, trauma-informed care, the wellness team, and when we hit those switches finally where we say there will be no barriers to behavioral health care whatsoever, there will be absolute recognition and reward of doing this level of screening, then we are ready so that downstream we could say, you know what, there is a clinical health worker, or community health worker available. There is finally a team of psychologists that are available to help with the family. And we have that unique capacity. We also have embraced all the traditional realms of healing, which I think is very important, because we recognize that maybe 30% of people prefer to not go into the allopathic Western healthcare system, but get better results by being with someone that is either from culture or has a different way to communicate. So we're doing all of those things, and sometimes they're hard to see, but I will tell you, some of these things are the reason that Hawaii is the health state that has the greatest longevity and so on. We are, for the most part, a couple standard deviations ahead of everybody, and some of those pieces are the reason.
You mentioned something to do. I would imagine that after tonight, they haven't already, everyone at the science will go take that mess and see what their score is. What's the individual level? What's, you know your score, what is the something to do?
Yeah, so there's a couple of different pieces. Number one, some of the most, my team boiled down something like 40,000 research articles into a very simple little wellness wheel that some of the evidence-based interventions that really help to regulate the stress response include healthy sleep, exercise, nutrition, mindfulness, mental health, healthy relationships, and time in nature. That last one, you all have in abundance. That might be part of the reason why you guys are so healthy here also. But each of those interventions helps to regulate stress hormone levels, regulate inflammation, enhance neuroplasticity, and some of them also have documented to show that they can help to normalize epigenetic programming. So the first piece is around, honestly, the power of healing, nurturing relationships, whether you are a child or an adult. One of the ways in which I incorporate this into my own well-being practice, one of my favorite things is the walk and talk, right? Which I do either in person with a girlfriend or even if we have to do it on the phone. And if you can have that healthy relationship part where you're talking about what is the real stuff that's going on with you and you're getting your steps in, that's like, something I really recommend. Or for example, there's a number of infant mental health practitioners in the house, maybe, over there. So, for example, child-parent psychotherapy, right, is another. So whether it's reaching out to a mental health provider or any of this, but there are interventions that we can incorporate as a regular part of our practice, and especially not waiting until the wheels fall off the cart, right? But as a regular part of our day-to-day well-being, I think it's critically important.
Another goes to bed early when he gets out at 3 a.m, so he's not getting his sleep.
But Donor, how do we incorporate the things that Dr. Burke Harris are talking about? For the most part, they feel like they are within reach. I mean, we do have a very high cost of living. We over-index in the amount of people who work, 2 different jobs. First, no high-density housing. We have a lot of issues, so that might prevent some of the things that they're talking about. But getting sleep, getting exercise, enjoying Hawaii, eating healthy, all of those things, we can do that.
Yeah, so we can, and the benefit of Hawaii is that as we continuously chip away at the list that the doc just shared, we will do better and better. These are things like, I always talk about this in the context of just pure social health, even beyond social determinants of health. Like, if we have a living wage, or we approximate a living wage so that there's not that second job, the walk that she just described is possible. If we haven't yet gotten here, if we have good paid family leave, right, then you actually can knock off one of those gigantic burdens on families who need to bond with their infant and avoid so many of the early ACEs that are out there. So there are some big decisions out there for us that I guess what I'm saying is, we read about, like, why haven't we done paid family leave? Oh, it costs so much. Well, she just told us that it's going to save us $40 billion if we make some of these right decisions. And we can hope that as society moves forward, and it's going to go up and then it's going to have moments, right? Okay. And I'm here to tell you, we're going to be okay. We're going to be okay as long as we stick with our lives and what we believe and our disciplines. These are intervals of challenge, and they have their stresses too. But if we gradually and we've come a long way. We now have insurance for all, essentially, in Hawaii. We have, seen our way to making sure that everyone has a primary care provider way better than we used to. If we make those incremental changes and deal with the deeper stressors, poverty, untreated addiction, those traumas, we'll get there. It's an interesting thing to be in Hawaii because we are an extraordinary test case. We are essentially a cohort of 1.4 million people who can't easily go elsewhere at any given time, okay? So we're here together. A few people go to Vegas, okay? But aside from that, we're here as a generation to see how we'll do. And the final thing I will say is I'm very focused right now. I constantly talk about affordability and housing because I really want us generationally to be able to stay and live and raise our children in Hawaii, not as an experiment to see if these premises play out, but because we have the opportunities in Hawaii to do things that very few other states can. They all go to the wind. They leave and go to another region. They don't have these deeply rooted values, the Hawaiian values that are hopefully being seriously incorporated into what we do. We have something special available to us, and so we will be a test case in some ways for what these other theories are. And I think that if someone ends up studying our outcomes and lays what we've done onto the population that's here, we're going to have something at least unique to share.
Yeah, absolutely. I want to open up the audience questions, and so we'll let the two of you pick it off. How about we got each of you ask a question to the other, Governor? Let's start with you.
Boy. Tell us, please, what was your experience during COVID in this space? I'm just very curious as a health leader.
As I mentioned, we launched ACEs Aware in January of 2020, and as it was as the COVID pandemic was really manifesting itself, I remember it was March of 2020 when we recognized that we were going to have to issue the remain at home orders. And I remember a consultant that we were working with on the ACEs Aware initiative said, okay, should we put this on hold to focus on COVID response? And I remember looking at her and saying, this is COVID response. Because it was immediately evident, right, that if we were going to issue remain at home orders, right, that intimate partner violence would go up, mental health disorders would go up, substance dependence would go up. All of these stress-related health disorders would increase, right? And this is what we saw. And fortunately, I actually ended up writing a memo to the governor and said, all this stuff is coming down the pike. So how do we put stuff in place to be able to respond? And one of the results of that was we were able to make the largest investment in children and youth behavioral health. $4.7 billion that the state of California has ever invested. And that was really, in partnership with our secretary, Dr. Gali, and really under Governor Newsom's leadership. And so it was a very interesting thing also because we were also engaging healthcare providers saying, hey, we want you to get trained. I said, you've got, a couple of hours to take this ACEs Aware training. And one of the things that was because we also had to pivot, but because we had planned to do like hands-on training and train the trainer, and we had to go to virtual really quickly. And one of the interesting things a pediatrician in Orange County said, you know, we did this ACEs Aware training because we knew it was a priority for you and for the governor and da da da. And he was like, and I honestly didn't know how much it was going to like be a thing. He said, I'm treating stress and trauma in every single patient I see every day, right? Because in the COVID pandemic, that's what, it was just activation of the stress response. So he was like, I had no idea how much I would be using this every single day on a daily basis. And I do the evidence-based interventions literally for like most of the patients that I care for. And that's the point.
Wow. Do you have a question for our governor?
Governor, I have to say that to sit here and listen to you is so joyful for me, because A, it's obvious that you really get it, and it's wonderful to see the leadership that is here and the way that you have created the Office of Wellness and Resilience and empowered the team. You know, as you are, it's so clear the depth to which you understand the importance of this work and the approach that you're taking is so impressive. What is your biggest obstacle, right? Because I know everybody thinks the big boss has all, you know, all you got to do is snap your fingers and make it happen. But what is your biggest obstacle, and how can all of us be of help to you?
Thank you. Well, thank you for such nice words. You know, I had the benefit of getting to observe people for all those years as a doc, right? So that was one of the things. It was really wonderful to be a physician while I came up in this field, in the politics field. I would say that the biggest challenge I have, I'm not certain this is the only one, but cynicism. And not cynicism from this particular audience, but cynicism from the world right now. It is deeply distressing to see so many people feel scared by what decisions might be made here, there, or on the mainland. There's a deeply cynical movement amongst people because they've been hurt or neglected or forgotten. And that is not just like left to center, intellectual, awesome people like you guys. It's a lot of people out there have felt so traumatized by everything that's happened that they are deeply cynical. So when someone like you or me or Kiabe or whomever speaks to a deeper approach to people's wellness or well-being, a lot of people just to say, hey, you know what, I'm checking out. I can't deal with it. They're writing stuff on social media, which is not cool. And I wrestle with that. I do, because I've met so many thousands of people. Just that's one of the blessings of this lifestyle I had. I mean, hundreds of thousands of people in person, and they're good people. Almost everybody that I've met over the years has been a good person, but there is still that deep cynicism out there. And I hope that we can turn that corner, because if we do, people will embrace a program like this. They will embrace healthcare for all. They will embrace a more civilized way for us to go about our work in our communities. But until we remove that cynicism, and I'm afraid for the moment it's been kind of growing in the moment, until we reverse that, I'm worried that we will miss years of opportunity. That's my biggest concern.
Let's turn it all over to some of you that we have some folks.
Thank you. Thank you, Governor and Dr. Burke. So I'm a graduate student here in philosophy, and I'm very concerned about the Trump administration's attacks on public health and science, especially with very dangerous people like RFK at the helm of HHS. So my question is, what can you do as governor to protect our public health and science research here at this university? Because many of my colleagues, speaking of trauma, they're very stressed and traumatized at things that are happening here as a result of some policies. Like websites are being removed, their and they're very stressed about it, right? Because their research is being affected. So, you know, please, what can you do to help us here at this university to manage that stress?
Sure. Well, thank you for that. So I'm super aware that that is going on, and a couple things. Okay, first of all, it's my responsibility to go and find whatever that pathway is to the administration, to have them calm for a moment. And I'm working on ways to speak sometimes in a language that they will understand. So when I was there recently, I spoke, for instance, about return on investment, which really is not necessarily at the core of the many things we do, although it is a part of the benefit of great public health policy and other public policy that we do well, and therefore we have more resources to invest. But that's the kind of thing that they understand rather than words like harm reduction. So there's a little bit of a nuanced thing going on right now, which I do what I can to actually be non-threatening in the moment with the administration, because they, interestingly, will need some collegial work to get done, some. That seems to be evident. I'm not trying to be naive. The other thing is, and I mean this from the heart, if you text me, and my cell is 937-0993, 937-0993, if you text me and say my program is in trouble, could somebody look at it, maybe there's a way we can blunt the attack, we will give it our all. I want to be very honest, I am hoping that they don't end up focusing on Hawaii. Not that I wish any of my other governor friends misery, okay? But I'm hoping that they see we have our own system out here. We have a different presence in the Indo-Pacific. There's no reason to really challenge what we are doing, which is working pretty well for us in our state. That's my current approach. But really, if any of the faculty or the deans or the graduate students have a issue, please reach out to me directly and say, look at our thing, can you help us protect it?
I did send it to your office.
Yes. Yes.
Well, and now he's got his cell phone, so.
Yes.
Yeah.
Yes, my cell is 937-0993.
All right, lots of
Yeah.
text coming tonight. Great, man. Let's get to some other ones if we can, as quick as we can, because we know we don't want to keep everybody in.
Dr. Burke Harris has also been graciously signed some books after this, so let's get to a few more questions if we could. I'm curious for both of you, what are the most effective intervention for ACEs that you see outside of the healthcare system? And in particular, are there interventions or could there be interventions in the education system?
Yeah, there are absolutely interventions in the healthcare system, and we know that, especially when we're talking about kids, right? Kids, education, in the educational setting is where kids receive the daily doses of the nurturing, buffering interactions that are the antidote to toxic stress. So I think that there are a number of different models. MTSS, multi-tiered system of support, is a model that can be implemented in the educational setting. And there is a book by someone by the name of Ricky Robertson called, it specifically targets around ACEs and supporting students impacted by ACEs in the educational setting.
Yeah, and Governor, that's why we need public preschool.
Yes, exactly. I was about to say that. So that's a very, Yunji stole my answer, but it's right. Universal preschool, pre-K, I think is a great place for us to be. We have our superintendent here today who is just plain terrific. And that's Keith. Are you here still, Keith? Where is he? Keith Hayashi. And so he's completely committed to also putting more healthcare into schools. So if we have that continuum from an early age, I think we're going to benefit the way Doc kind of told us.
So with all of the craziness going on at the federal level, or in the nonprofit sector, seeing a lot of our partners fall and a lot of these services that work to either combat or prevent these ACEs from developing in the first place be ripped away and be ripped away very suddenly. It's already started. I think there was an article by HPR yesterday about the food bank losing around a third of its budget. and especially on neighbor islands like these, nonprofit services are exceptionally critical. How do we begin to not just address the loss of services themselves, but the very drastic, probably COVIDian jump in the cases that's going to happen to our youth during this?
I think, so to be honest, I think that when we look at the way that a lot of these things are happening right now, similar to some of the attacks on kind of very straightforward things like vaccines, right? That it's not actually based in science. One of the things that, I'll just say what I believe. I believe actually some of the dynamics of the ways that things are being done are actually almost deploying the science of toxic stress as a tactic, right? So, disorienting people, having things be sudden and drastic, and instilling fear, right? And that is done with kind of an instinctive or intuitive knowledge of that weakens communities. And it weakens communities with the, to the end of reducing the resistance, right? And so one of the things that communities who have been through horrible trauma historically recognize is that our strength is sticking together. Our strength is in community, in caring for each other. So we may not have control of all of the things that are happening now, but our ability to nurture ourselves and each other so that we can not only make it through, because you remember I said when you activate the stress response, your prefrontal cortex goes way down in your ability to do executive functioning. And that's to make it harder for us to strategize, organize, and resist and persist, right? And so that piece of really practicing that self-care, really doing the nurturing interventions, taking care of ourselves and each other. I believe, like every time I see some like very sad or scary headline, I think to myself, okay, this is an opportunity for me to care for myself and for my people, right? So that ain't nobody getting me out of this fight, right? I'm not gonna self-select out. Although if people need to take a break, absolutely, people should do what they need to do. But I actually think that making some of the practices that will help us get through this time will also help us to be able to organize and be very strategic in responding.
Yes. It really couldn't be said better. I know that we're coming to the end of the evening. I would just echo that. Don't quit. You may have to retrench a little bit in different parts of one's life, which is okay. There are a lot of things we've all wanted to do and haven't had the time to do, perhaps. Focus on a few of those things, but stick with your disciplines, whether you're going to be a faculty member or a nonprofit leader or a clinician. Don't quit the system, because this is actually, if you look at it, a brief period in time, which is definitely traumatic and intentional. That's something that is true. So Nadine is correct. Just don't quit, and we will do absolutely what we can. We are going to do $20 million for the food bank to have a food safety system, because we are a little different than most other states. So we will do some of those things. Please don't quit this battle, because if the millions of people that have their jobs threatened right now do leave, it won't matter in 4 or 5 years once we attempt to return back to a therapeutic normal. We will be out of the discipline. Don't leave, please.
Let's wrap it up now. Let's review with you, Asaf, with a final thought for our audience on what to do with this information and marching orders, if you will.
Sure. I would just say mahalo for being here, for meeting Dr. Burke Harris. It's exceptional what happens when we have individuals who have this level of experience to share. And if you can, share it with the many hundreds of people that you are connected to and let it flow through Hawaii, because I think what she brought us tonight is special. And this is an excellent group of leaders, but magnify her message, please, and let us use this as a time where we can bring some calm and look to those who are most vulnerable.
And Dr. Burke Harris, can you do the last word?
I want to say that under Governor Green's leadership, the director of the Governor's Office of Wellness and Resilience, Tia Hartstock, is here. All of the ingredients to do this transformational work is here in Hawaii. So you all have all the ingredients you need, and I just want to encourage you and say congratulations for the amazing work that is being done right now and the amazing work that you have ahead of you.